This is an example of a stomach that has been opened to reveal intestinal type adenocarcinoma of the stomach. The primary lesion is here. There are two secondary lesions here and an area of ulceration. This type of tumor is associated with H. pylori infection, atrophic gastritis, and intestinal metaplasia. Precursor lesions include flat dysplasia and adenomas. Incidence is about 20 times higher in Japan, Chile, Costa Rica, and Eastern Europe compared to the rest of the world. In contrast to diffuse adenocarcinoma of the stomach, intestinal type adenocarcinoma of the stomach is a localized lesion. Most gastric adenocarcinomas arise in the lesser curvature of the gastric antrum. Grossly, the tumor may appear as a fungating mass or, as in this example, an ulcer. The non-neoplastic mucosa adjacent to ulcerated tumors is usually thickened and heaped up, which you can appreciate here. Microscopically, the cells have the appearance of malignant intestinal type epithelium. Well-differentiated cases display apical mucin, while poorly differentiated tumors appear as sheets of cells. Depth of invasion and extent of nodal and distal metastases at the time of diagnosis are the most significant prognostic indicators. Surgical resection is the preferred treatment.